I think there's a lot that could be done to minimize the risks for these people who wish to go through Ramadan, whether they will fast or not, because many of those who will not fast might be embarrassed to eat and drink during the day, so they might face the same risk of hypoglycemia. Equally, during Ramadan, many people, as I've mentioned, that one of the risks is hyperglycemia. That is because, like many religious festivities, it becomes a feast. Like Christmas becomes a big party of lots of delicious meals. But you can imagine that Ramadan is 30 days. So in many circumstances, it would be 30 days of feasting. So hyperglycemia could be a problem for the fasting and for the non-fasting person. How do we minimize this? By understanding all of this and by better planning. So we know when is Ramadan going to be every year. Healthcare professionals, as much as patients, need to prepare for this, need to see their doctors and nurses in advance, need to understand the healthcare professional need to quantify the risk of the individual and work with them in case that risk could be modified, maybe make the necessary changes. And above all, the most important is education, education, education. Education for the community, education for the healthcare professionals, and indeed education for the person with diabetes herself or himself. Well, lifestyle of the individual during Ramadan could be a crucial factor in Ramadan management for people with diabetes. We've talked about the choices of food, and that really need to be expressed in clear terms during the educational sessions with the individuals with diabetes. What are the better choices compared to the less healthier choices? Equally, the portion sizes. There are lots of habits that changes during Ramadan to become less healthy, lots of types of foods and drinks that are consumed, and maybe in large portions. So thinking of the portion size is also very important. Physical activity. Of course, now Ramadan is in July, in June, early July, and the temperature is warm. So in one hand, it can help people to be physically active, but they need also to be careful about not exposing themselves to too much of the heat. So what time do you do your physical activity? Monitoring of the blood glucose is essential, especially with the knowledge that from a religious point of view, it's not going to violate your fasting. That will help the behavior change. If I want to indulge into a nice rich food, monitoring will tell me how high did my blood glucose level go. So do I take the same portion tomorrow? Do I do that every day? Or shall I restrict the portion and the frequency? And so on. So teaching on the lifestyle measures and the self-monitoring is really very, very important here. The medication available for treatment for people with diabetes, some of them can cause hypoglycemia, some of them are very low risk of hypoglycemia. And consequently, the choice of medication would be important in trying to minimize the risk during management of Ramadan. So myself as a healthcare professional, treating a person with diabetes, need to be aware of the religion and the practice of this person. And maybe this is something that is not very much applied in Western societies, where we feel that asking the patient or the person about his religion and about his practice is maybe intrusion into private life. But obviously, this has a significant impact on how can I manage. Because if I now need to have a medication, and that medication can increase my risk of hypoglycemia, and that would make my risk much higher during fasting Ramadan because I'm a Muslim and I would like to fast, and you have a choice of treatment, then you could have chosen the other option. So I think being proactive and asking people about, do you practice Ramadan? Do you wish to practice Ramadan next year? Would be tremendously helpful. And that's not just before Ramadan. In fact, a week after Ramadan is over, if I need to go on a second or a third line therapy, you need to think of me as a person coming from a Muslim faith along that route, rather than waiting until it's a bit too late and then start to think, should I switch? Should I stop that drug? Did I already start the wrong type of medication? Or maybe not the wrong type of medication, but not the preferred option from the risk point of view.